repeat.
Welcome to the Left-Wing Kingz podcast. Today we're going to be talking about mental health concerns in the black community, tips for elderly care and final preparations, and the reasons we should fear. JD Vance, the VP pick for the Republican Party. I am your head moderator in charge of HMIC Malik, and I'm joined today by King Ace.
What up, what up?
King Matt on the comments in the background, holding it down, making sure we keep our timing correct, and our special guest, Claude Nogas. All right, thank you for joining us on the show, Claude. Please tell us a little bit about yourself, sir.
Sure. Good morning. So my name is Claude Nogas, and I'm a native New Orleanian. I've traveled all over the world with the Department of Defense. I was a healthcare administrator there, and I just retired in August of 2022. So I'm a Dillard University graduate, an HBCU graduate,
All right.
in the house, definitely.
Yes, sir.
And
I almost went to school there.
oh, did you really?
Yeah, I ended up going to Prairie View.
Oh, okay.
Yeah.
Okay, absolutely. Great HBCUs. And I came from the inner city. I grew up in the projects of New Orleans. And
Okay.
so, you know,
He's a hot boy.
9 o'clock stabbings and 10 o'clock shootings.
He off them wards over there. You
Yeah,
know,
absolutely.
New Orleans
Absolutely. Not the boroughs, but the
Yeah.
wards and the parishes.
Yeah.
exactly.
All right. So, I think you're the right man for this conversation that we're about to have today.
Thank you.
So let's break it on down. We're going to start off with 5 mental health and dementia concerns for the black community. Now, mental health is a complex and challenging condition that affects millions of people worldwide. However, the black community faces unique challenges when it comes to mental health. So today we're going to go ahead and explore the 5 key concerns of mental health with a focus on dementia. Now, I was about to say, Claude, I know you have an experience with this, so we're going to jump right into concern number 1, which is the diagnosis delays. So early diagnosis of dementia is essential for effective management and care. Unfortunately, black individuals often experience significant delays in receiving a dementia diagnosis. Claude, how did your diagnosis come about, and what challenges does dementia cause in your life?
Sure. Thank you. So in November of 2022, I was diagnosed with early onset dementia. I had COVID in 2020 of July. And as you know, during that time frame, we did not have any significant testing centers for individuals to go to, especially in the black neighborhoods. So I waited like 3 weeks before I even got a chance to see doctors. So one of the things that I accomplished was, with working for the Department of Defense and working in the healthcare environment, I had direct access to nurses and nurse practitioners and PAs. So I survived basically working on the household remedies without going to the emergency room, without going to see a physician. And I would say about maybe 10 months, should I say, after that, I started having memory fault issues. I started having issues where I would forget my keys. Started having issues where I went to the mailbox and ended up at HEB, not knowing why I was at HEB.
Wow.
So I went through a lot of psychological testing, a lot of mental health testing to solidify a diagnosis. At that time as well, I started experiencing some damaging hearing loss. And so right now I have a 60 to probably 65, 70% hearing loss in both ears. I wear hearing aids. That has been a success factor for me. Although in our black communities, you have individuals that are still experiencing the difficulties of getting hearing aids. For example, my hearing aids are $5,200.
Man.
Thank God I had federal government benefits.
That's a damn used car right there.
That's right.
Well,
That's right. That's right.
I think I
That's
just
right.
ain't gonna hear nothing. You know what I'm saying?
That's right. That's right. Absolutely. So
Call Helen Keller because I'm just.
yeah, exactly. So then after going through all of the testing and experiencing the anxiety factors, I was sick at home, and I just had to come to grips to go to the psychologist, go to the neurologist, go to the speech person, and hey, let me do these tests. And it came back saying that I had frontal and temporal lobe shrinkage, which impacts the emotional and behavior side, and also my cognitive side. So I have a cognitive impairment to include behavior and emotional issues, which stems from that onset dementia. I think it's very, very important for us to get treatment. I still hear today from Black Americans that say that they have memory fog issues. My advice would be go through your primary care physician to seek testing and seek treatment to identify what that treatment should be.
Yeah.
Hey, Claude, real quick. Let me jump in real quick.
Yes, sir.
What would you recommend the age be to start looking for signs for that?
Well, the only onset dementia criteria could possibly start at the age of 50 through 65.
Okay.
They did mention that I would have probably had dementia at the age of 75 to 80, but COVID triggered those actual symptoms.
Wow.
And the actual diagnosis.
Wow.
So.
Oh wow, that's yeah, and we were talking about the delays in diagnosis and listening to your struggles. You're in the medical field, so a lot of things you were able to do was because of your connections. Imagine if you didn't have those connections.
Oh yeah, absolutely.
Yeah. So
I totally agree, and I think not just having the connection and the resources, but within Black America, the education plays a major role in this.
Sure does.
If you are a high school graduate and you don't have the resources, the educational and the financial resources to get checked, then you fall amongst the wayside, because I can guarantee you, if you are dependent on the government and these subsidy programs to get you in, you're dead.
yeah.
Well, I think that this is a great tie-in to concern number 2.
Yes,
And
sir.
concern number 2 is healthcare inequities. So healthcare inequities play a significant role in the challenges faced by Black Americans with dementia. This disparity is often due to, like you said, systemic racism, socioeconomic barriers that exist, and a lack of culturally competent healthcare providers. So, Claude, what are some of the healthcare challenges that we might experience as Black Americans, and maybe even tie in some of those things that you've experienced?
Yeah, and so I know from my focus and my lens, as I look back on this and some of the things that I have done, and talking to family members and also friends and coworkers, COVID-19 had a very much so impact to the world.
Yes.
And from a government perspective, we talk about the continuity of care, the access to care, and some of the things that we need as human beings. And I can tell you that there is a health disparity amongst Black Americans. There is a mental health impact amongst Black Americans. I can tell you that the economic strain is tremendous within the Black community prior to COVID and post-COVID. Prior to anyone having memory loss or memory fog. And also, there is a concept that's out there that is real. It's called educational disruption. And educational disruption is the ability to have access to the resources so that we can remotely understand and make a determination what needs to be done, just from a humane perspective.
Right.
So those are the four things that I've seen that play a major role. Now, also, let's be real, okay? Project 2025 also has an impact to all of these situations. Black patients having the ability to have continuity of care, access to care, mental health communities for the color, okay? I have great insurance. So I have 2 neurologists. I have a psychiatrist. I have a psychologist. I have an endocrinologist. I have every special care provider and every primary care provider within my treatment plan that supports the possible disparities that I would embrace as a black man.
Yeah.
So I say blessings to me, but I fight for my black Americans as well.
Yeah.
So when we're talking about Project 2025, guys, don't let the Trump administration fool you.
Yeah. So.
That's real. And dig a little bit more into 2025. We talk about it a lot here on the show. But what are some of the effects 2025 are going to have on, getting mental health care and stuff like that? I mean,
for the elderly, and this is what our focus is, it is my understanding by just glancing through the Project 2025 document that Medicare Part D enrollees nationwide are going to be impacted. And it doesn't matter who you are.
Yeah.
If you see that there is a reason for the Trump administration to be voted in, then guess what? Wake up.
Yeah.
Because there are a lot of targeted and proposal stipulations that are in there that are dismissed. And so if you're not aware of it, do some research.
Yeah, they're fighting for deregulation, and that's going to affect a lot of the organizations that you're talking about, medical organizations, but also they're rooting for big pharma. You know what I'm saying? So they're gonna raise medication, and this is something they got written in that $900 document.
Yes.
You know what I'm saying? So
yes,
yeah, you got to be aware of that.
Yeah. So I would say to the audience and the community, educate yourself. That document is out there. Even if you have AI experience, which is artificial intelligence experience, go out there and do the research sources. Get the snapshots of what you want to see as an American citizen prior to going voting.
Yeah. Well, I'll tell you what I want to see. Somebody hitting that like button.
He said,
so,
Claude.
If you like this content and you feel that you want everybody else in the world to watch it, and let your black brothers and sisters know about Project 2025, damn it, hit the like button. All right?
Absolutely.
And make sure that you subscribe to this channel and share this content on all of your social media platforms out there. Now, with that being said, we talked a little bit about 2025 last week, and one of the things we talked about was the fact that Medicare, like you said, Affordable Care Act, they're looking to roll back a lot of the money that they're giving to people who depend on that. And unfortunately, people in our community are highly dependent upon those resources for their health care. And so that brings us to concern number 3, which is a lack of resources. So black patients are less likely to have access to quality support services and resources. Providing quality support and resources is vital to ensure that any individual receives the care that they need. If they don't have the access, they can't get the care. So Claude, what resources are lacking, and which resources do our viewers dealing with dementia need to be aware of?
So again, there's always been a disparity within healthcare. And we title that structural racism. What does that mean? So when we look at structural racism, we're absolutely talking about the discriminatory effects in healthcare. What do you experience when you go to a healthcare facility on the south side versus the north side?
Yeah.
What do you experience when you're in an elderly retirement community, 55 and above, and you got all the healthcare individuals at the community center, and the average income in that community is $77,000 to $125,000. Imagine what that does to someone that's making $25,000.
Yeah.
Okay. Now you're going to talk to me about Project 2025, and we're going to talk about a $400 savings. That's crap to us.
Right. Exactly.
There is a possibility, or there is reality, should I say, that you could spend $400 on Wegovy,
Yeah.
Done.
I would say
There
that's
you
one
go.
medication.
Mounjaro,
Yeah.
Ozempic, $400. So Project 2025, guys, again, is crap. Read it, understand it, don't vote for it.
Thank you.
Yeah, that's strong words right there, definitely. And breaking it down to where people should be able to, look at this on a day-to-day basis and see how it's going to affect them. You know what I'm saying?
Sure.
I mean, I got medications, you know what I'm saying? So they're not going to give you anything back for that, and they're going to roll a lot of stuff that you're doing right now. Don't be blind with it. I think a lot of people want to make a mistake because they're not going to vote at all.
That's
You know
right.
what I'm saying?
Yeah.
Oh, now that's definitely a mistake, and again, that goes to us not understanding, and there are things that we have to accept at a certain degree of level, but what we shouldn't accept is for us to not vote or to go and vote for Robert Kennedy.
Oh, yeah, don't do that.
What a waste of voting.
Yeah, don't do that.
All right. The healthcare bias is another one. And poverty. We can talk about poverty all day. Unemployment. We can talk about what those rates are. Socio-economical factors is also a level which does not promote you getting quality healthcare support and resources.
Yeah.
Period.
Yeah.
Let me play devil's advocate here real quick, Claude. Some of our people would like to say, or some people would like to say, yeah, that was back in the day. But this is 2024, man. That ain't, that stuff doesn't affect us now. It's, structural racism. What do we say to that?
Oh, it's easy. Back in the day, you were hung from a tree. Today, it's modernized slavery. And Project 2025 is a firm example of what that is. So you could look back and say it's different, but really it isn't. Really, it isn't. And to me, this whole thing is that there's a time when pipe bombs are going to be dropped in your home. My dad used to tell us, hey, go to Woolworth and get a ribbon and let's make a bow and put it on the front door so that when the Black Panthers come through, they don't throw pipe bombs in your house. So, ignorance.
Yeah.
It's ignorance.
Yeah.
Get on board, guys.
Well, luckily, we don't got to worry about the risk of pipe bombs up in this motherfucker no more.
No,
Who knows
but
what's
I
going to
mean,
happen next year?
you never
But
know.
There's still a risk that we have as Black Americans, and that's kind of like concern number 4, which is higher prevalence and risk factors that we have in the Black community for our health. So Black Americans are twice as likely to develop dementia compared to their white counterparts due to higher rates of things like hypertension, diabetes, cardiovascular disease, all of that. So Claude, can addressing these health issues help to slow down the onset of dementia and the symptoms that comes with the condition?
So, losing your memory is worse than losing your sexual appetite. Because when you lose your brain cells, when you lose your mind, there's nothing else. Eventually, everything else just goes away. When we're looking at what are some of those things that could help, regular exercising could help. I was just told this week by my doctor, he's like, hey, Claude, walk around the block 10 minutes every day. And don't target it as a scheduled walk. Just get out and do it. And before you know it, you done walk the whole entire subdivision.
Oh, wow.
And that equates to your 10 minutes. If you want to process something about Project 2025 or the election or politics or finances, get up and walk. So, there are many things that we could do, but understanding how to manage those chronic conditions. As I mentioned before, I had high cholesterol, hypertension, I was pre-diabetic, ADHD, bipolar, and every damn thing else. So I had to take charge of my weight. And just 6 months ago, a year ago, I was 270 pounds.
Wow.
Now I'm down to 230.
That's awesome, man.
All right? So let me tell you what has happened, and let me tell you what the impact is of you individually taking care of yourself. Diet, sleeping, stress management, social engagement, and home monitoring. And what I mean by home monitoring, get rid of the drama. Get rid of the kids that are causing you problems. Get rid of the things that in your life that are not a primary factor to you not losing your brain.
Yeah.
Bottom line.
Yeah, that's good advice, right?
Yeah, exactly. And
home monitoring.
Home monitoring. So I went to my doctor and I told my doctor, I said, hey, look, man, I already got the brain thing going on. I don't need a stroke. I don't need high cholesterol. I need medication for the bipolar. I don't want to fight. The stressors, the ADHD. I want to stay focused. So I told my doctor, I said, you know what? Put me on Wegovy so I can lose the weight. I had 2 knee surgeries, back to back. Wegovy has been a tremendous success to me. 30, 40 pounds.
Yes, sir.
My A1C is now down to 5.2. I'm no longer not a pre-diabetic.
Awesome.
Cholesterol's down to 75. Weight down 30, 40 pounds. So there's a part in life where you have to take care of your health. And the last thing I want to say is that vascular health is very, very important for us.
Yes.
I have a 10% blockage in two arteries. I have a 10% blockage in 2 arteries. And every year I go and get that checked because my dad died from a major heart attack with 80% blockage. And I was 19 years old. So vascular issues goes through my family like someone swimming. Yeah.
So we did hit our time, but I think we got one more thing that I want to touch on before we go on to the next topic.
Yes.
And it's vitally important because we're talking about things like we've been kind of mixing in and think about Project 2025, the impact of the Black community. And one of the things that is the final concern for our healthcare is number 5, which is cultural stigma and awareness. So cultural stigma surrounding mental health and dementia can prevent individuals from seeking help and support. In many Black communities, there's a lack of awareness and understanding around dementia, leading to misconceptions and fear. People are afraid to say they got this or that or whatever. They're afraid to go to the doctor, whatever. Claude, how can we increase education and awareness about dementia and our mental health to help reduce the stigma and encourage early diagnosis and treatment?
So I think one of the bad things, I'm not going to say bad things, but one of the challenging things that we have as a culture is that we don't feel that we should share our health experiences. Sharing your experiences could be the reason why someone go and get a psychological test to see why they're having memory loss. And if you don't do what I'm doing today, with sharing it with the nation, then the devil will make you think that you're the only one experiencing those things.
Yeah.
The devil comes in and say, hey, you know what? You're the only one got dementia, Claude, in the corner. You're the only one that goes to HEB. You're the only one that put your keys in the refrigerator with your Bluebell ice cream.
Yeah.
And we sought to sabotage ourselves.
Yeah.
Shoot, when you was mentioning that, I was gonna say, shit, that's everything that I do.
Yeah, but it's funny because I was watching The Boys. I know you do all that shit. You crazy to the mouth. I was watching The Boys. And there was one part where this lady says, we're all the hero in our own story. And that's what that reminds me of when you say that. Like everybody has their own experience. When we all leave this and we by ourselves somewhere, we in the room by ourselves, we just thinking about us, and we're always thinking about it. We're always the heroes of our story, and we write what we write, and we think we're the only ones out there.
Only ones out there, yeah. And so another thing is navigating the health system, okay? Make sure that you have a team of healthcare providers at one location from a healthcare system perspective, so that all of your documentation is in one electronic healthcare record.
Yes.
One of the things I found out, and you know, I was challenged with this with a very, very good friend of mine, Venezuela Body, who was an executive nurse for the military. And she said, Claude, you're running around from doctor to doctor, picking up documentation or having it scanned to your primary care doctor. Why don't you get into a healthcare system? And she also told me, nobody knows our health but an educated black provider. Mm-hmm. There are black cardiologists out there. There are black psychologists, psychiatrists. Mm-hmm. So focus more on that and look at what those resources are, and have the emotional intelligence, the emotional well-being of identifying that you as a person need help. Listen to your spouse. Listen to your best friend. Listen to the people that have your support, and go to the doctors.
That's awesome, man.
Yeah,
I love
that's
that.
good. That's good right there. I like that. The electronic, everything in one place. Nobody thinks like that, but you know what I'm saying. But yeah, get that to the point where when you go into all these doctors, you got all that ready for them, and it's all in one place to find.
Yeah, I have
That's
it. Like I think mine is under Baptist. I think medical system, and all of the doctors that I have, all the specialists, my primary care, they're all in there, so they can all see everything. But I do want to go ahead and touch base real quick on. We got some comments out here on YouTube, Facebook, and all the likes. So I want to touch on some of those before we get into the next topic. So first and foremost, Peter J. Milner's in the building. So what's going on, Peter? Thank you for joining us as usual. All right.
That's good. Good to see you, baby.
We got Tropical Paradise who says, good afternoon, all. Special hello to Xavier. Okay. I don't know who that is.
That's me.
Okay. Xavier Claude. Okay.
That's my middle name.
Okay. Claude Xavier.
Yes.
Okay.
Yes.
There we go.
Xavier, I knew he was in prison.
All right.
I was like, oh, go on, Xavier.
Now, Peter says, whilst I and my family are white Brits, my father had dementia for the last 5 or so years of his life. So I have experienced it firsthand. So, I mean, man, we could have had you on the show too, Peter. I would have loved to have you here, at least remote or something by, Zoom. But hey, there's a lot of people out there experiencing this, this condition, and understanding and getting help for it is critical.
Sure.
Let's see here. So Peter let us know YouTube's struggling a bit, so we'll see if that picks up or gets any better. So I appreciate the info. Matt's on. We got John Kirkpatrick. Oh, John Kirkland Bonham. I wonder who that is. He says, black folks need to find ways and means to provide for the opportunity to have good care. The idea of what may be in store for us as a black community with Project 2025 is frightening. Better blue with any candidate to take the risk of a man with no impulse control or empathy. I don't think anyone here disagrees with that.
Nah.
Absolutely. A perfect way to put it. Thank you, John.
All right. Steve McClintock's in the building. What's going on, Steve? He says, great topic. Peter wants to ask you a question, Claude. Peter says, can I ask the kind gentleman a question?
Yes.
When someone speaks to him, does he rattle his fingers on the table? Also, does he move his food around the plate before eating it?
Yes. That is a sign of dementia. That is one of the symptoms of dementia. I find myself sitting and twiddling my toes, or trying to twiddle my toes. I find myself doing this when I'm just idle and looking at television. And that is the motor skills side of my dementia. And I've kind of researched all these things because if and when I become senile, I've had a tremendous life. I've had a God-living life, financially successful, I've done things that I wanted to do. I've lived all over the world. And so people say, how do you accept this diagnosis? I accept it because there's a God.
Yes, sir.
And he has given everything to me.
Yes, sir.
So with that in mind.
Love it. All right, we got Steve on the house. He says, and Steve's on YouTube. He said the cost of medicine and also the cost of caregivers once a person has advanced dementia or Alzheimer's can bankrupt a family. We as a society need to take better care of our senior citizens. 100%.
Oh, and I agree with that. And you know what my answer is to that? I'm going to spend every cent that I have been blessed with. And when it's time for me to lay my head in that nursing home and not know who anyone is, the federal government better come with it.
Damn right.
Because let me tell you something. I could sit next to you and you get everything free. And they're taking all of my money from my TSP to pay for my care. Not going to happen.
Yeah.
I'm going to travel the world, do all the things that I want to do. And that's the way it is.
Yep. And then y'all take care of my ass. Yeah. Okay.
That's right.
Yeah. Cheryl Wright is on YouTube, and Cheryl says, if Project 2025 becomes a reality, then what's next for black and brown people? Shit, I don't want to know.
Wow. Yeah, Cheryl. It's, you want to do the research. We talked about this last show, but it's, it's really like Trump centralizing the government directly to him. So if you're secure with what you think, you want Trump making decisions with you on some of your basic needs in life, then you'll be happy with Project 2025. You know what I'm saying? But I don't trust him. Exactly. I don't think that's going to work out for us.
Nah.
But yeah, we definitely got a little more details last show. But it's
frightening.
It's frightening.
Yeah.
That's a good way to put it. It's frightening.
So Steve on YouTube says there's definitely structural racism, and it's even more complex because a lot of times we don't even realize it's there, at least before it is obvious. Yeah, that's why you need to read shit. That's why we need to read. They got a plan, a plan to execute racism.
Structurally.
Yes.
Yeah.
Which means that it is designed in a document called Project 2025.
900 pages.
Yeah.
They knew black people wasn't going to read that shit. 900
And
pages?
they think that you black folks are not educated enough to see what's under the table.
Or you can't do shit about it.
That's right. Shame on you, Trump.
No, this is what I like about it. Somebody took time to write out 900 pages of a plan to take over the government.
You know how many people had to be involved in that planning?
And people think like, don't worry about it. That ain't nothing. I'm saying, I don't even know that exists.
Shit.
900 pages, bro?
Russia may have been involved with that plan.
Yeah.
Yeah.
They
might have been.
Who knows?
It's set up and designed to take over the government. That's
right.
the easiest way to say it.
Yeah.
Absolutely.
And take away your rights at the same time.
Absolutely.
Yeah. Steve McClinic on YouTube. This is going to be the last. We're going to go through two more comments and we're going to jump into the next thing. I think it was important for us to go through these comments just to show our viewers some love out there. So I know we went over our time, but this is critical for us to make sure they're part of the conversation. Steve says stress management is a big factor. Always protect your peace. That goes back to that home monitoring piece that you talked about. And then, of course, John Bonham, he better agree because he at the house. He says, true that to you. Say it to Steve.
Absolutely. And Steve McClintock is my cousin.
Yep.
Absolutely. Steve, you're absolutely correct. Stress management is a killer. My daddy used to tell me, you can't pay dollars for mental health and peace.
No, you cannot.
So he used to tell me, Claude, get it at all costs, no matter who it is, no matter what the situation is.
That's right. That's beautiful, and that's true. Last comment I wanted to say was, this is from Peter. This is a really, I like this comment. I don't know why, man. I'm just kind of Peter always come through with some shit that make me think. Peter says, my father was a very clever engineer. He was an engineering officer on the original QE2 and spent a lot of time in New York while it was docked there. He lost dignity, I guess, with dementia, which is the thing that upset him more than anything. And that's It's sad, man. I mean, we can lose our dignity through anything, but usually it's by our own control or lack thereof. But
Yes.
in this situation, dementia is a condition that just comes on, and at some point, I mean, I don't understand the condition as much as you, Claude, but I would think that at times you kind of as it progresses, as the
Yes.
disease progresses,
Yes.
there will be times when you don't know who I am.
That's right.
And then there'll be a time when you do remember me.
That's right.
But
And
when you
then-
remember, you're gonna
That's
be
right.
like, "What the hell is going on?" What
Yeah,
is-
absolutely. And you know, there's a time also as well. My doctor told me that since I'm a chef, I'm a Cajun Creole chef, that I would eventually always know how to cook and do a recipe. Now, the issue is, he said, is that will I have the motor skills to pick up the spoon?
Oh wow, that'll be frustrating. And
That's the issue. But I could always cook.
wow.
All right, well, let's get some shrimp etouffee. You know what I'm saying? Before it's too late, Claude. You know.
Ay,
so-
You want some gumbo too?
I'm
Well, look, man, I
putting my order in right now.
yeah, man, put your order in, man. But I got a surprise for you. God is telling me I'll be okay.
Yeah, you gonna be
Good. That's what I'm saying.
You
All
gonna be good.
right.
But
we
just in
talk about-
case.
Yeah, just in case. Get them shrimps ready. So we talk about preparing food, but let's talk about making some final preparations. That's our next topic. So our next topic is the top 5 tips for elderly healthcare and final preparations. So as we age, planning for future care becomes increasingly important. But in the Black community, many of us disregard planning for our old age, which leaves us in dire straits when we reach our golden years. So we're going to enlighten our viewers with 5 ways to prepare for elderly care and their final preparations. So the first tip is assessing your needs. Evaluating your healthcare status and any chronic conditions you may have is important. Claude, what are some of the things we should consider as we assess our elder care needs?
You know, the final expense insurance is very, very significant. In our community, we have challenges and issues with life insurance and whole insurance. There are companies out there that do provide final expense insurance. You can go to Omaha Health and call some other insurance agencies. Also, there are financial consultants out there that you could go and look at successful ways to ensure that there is funding and a guaranteed life insurance policy. Also, make sure there's a will in place. Make sure there's a trust in place. Make sure that there's a transfer of deed in place if that's something that you want to do, because we know how we are when people die. You know, everybody comes out of the woodwork through the windows to take the jewelry and trying to find out how much money is there. Mm-hmm. So take time to protect your immediate family, your spouse, and your children, and also to budgeting. Having some type of financial dream that turns into reality, that's remarkable for that success. Like, for example, I've mentioned to my spouse that, hey, look, the minute this occurs, I want to be put in a nursing home and for you to go on with your life. I don't know who you are. I don't know that you're even here. So financially, I'm making sure that I'm okay before it progresses and that there are things in place for my spouse and for other people to adhere to.
Right.
So that I could get the appropriate coverage that I need and that, things go smoothly. So again, you have long-term care, life insurance, whole insurance, guaranteed life insurance, final expense insurance. Now, if you go to an insurance agency and the final expense insurance, you cannot get it due to your medical condition. then I'm going to request for you to go to a local funeral home, and they also have final expense plans for you to start paying every 2 weeks, every month towards your final preparation, whether it be to have a funeral burial or to be cremated.
Oh, that's great info.
Yeah, that's real good info. We need a whole show on that.
Yes.
But definitely, Claude, no, good info. Black people, well, all people, no more barbecue plates, man. This is what they saying, man. When people die, man. Like,
No more suppers.
no more chicken quarter barbecue plates. So the chicken quarter ain't cooked good. Beans is cold, and all you did was take HEB potato salad and put a scoop on it and put it on the side. I'll just give you the $10.
Mix some pickle juice in it, yeah.
Yeah. So that's what Claude's saying right there, man. You got to make preparations, man. We can't be burying our people on chicken plate fronts no more, man. So.
And you bring up a very, very good thing, because like I mentioned to you, I grew up in the hood, right, in New Orleans. And so we've always done suppers on a Friday and card games on a Friday to pay rent the following week, you know. You can have those activities and have those parties, but if it rains and nobody comes, then you don't have the money to do what you want to do.
Exactly.
Yeah, we got to do a better job planning, and and that's where the will comes into play and all of that. So
Yeah.
we actually got to get out there and do a better job as a people.
Yeah,
So
and
good
you
stuff.
know, I don't know if all the kids know about this, but GoFundMe is probably something they know a lot better. They probably like
Oh, man.
you talk about raising GoFundMes.
Man,
you know?
look, I hate
GoFundMes pop
GoFundMe.
up all the time when somebody
Yes.
passes away.
Yes.
What we see all day. Now, I ain't shooting nobody. I ain't trying to say nothing bad about nobody, but this stops you from having to depend on the generosity of others. Just take care of it yourself.
Yeah.
man.
That's
Handle
right.
it your damn
That's
self.
right. And you know, people are people, and you learn as you get older. You're in this battle by yourself. I know that I'm in this dementia battle by myself because I'm the one that's impacted.
Yep. Exactly.
Although there's people out there that love me and love me dearly,
Yeah.
it's all about me.
Yeah. And the last thing I did want to touch on for this, when we talk about the first tip, which was assessing your needs, is also as you're here and before anything even happens to you, make sure that with your primary care physician, you're looking at what your medication needs are, or like you did, you told your doctor, I want this drug. Have that conversation about, if you watch a TV, there's all these damn commercials about drugs that's going on
Absolutely.
every day with all kind of shit. You could be asking your doctor, hey, will this work for me? Will that work for me?
Absolutely.
And they'll tell you why it will or won't. And you can come to a decision with your physician, because sometimes you can start taking care of the symptoms and things ahead of your diagnosis, right? Before those things even come on. Make sure that you understand what your healthcare requirements will be when you go into dementia. Like you said, hey, I know what my requirement will be at this point in my life. I want to be in a home because A, B, and C, right? I know what my requirements will be. And understanding if you are going to be in a home, what facilities are out there and what amenities do they have? What's their reviews saying? Things like that.
And shit, make sure you have family
Yeah.
that's going to come and visit you because
Exactly.
that's a problem.
Yeah, exactly. So assessing your needs it's a very wide-ranging topic, but I think that there are many things that people need to consider. And just like you said, I think it kind of ties into some of the things you said ties into our second tip, and that's creating a financial plan. So financial planning is a critical aspect of preparing for elder care. If you're living on a fixed income, your options for elder care could be limited. So how can we get fiscally fit, Claude, and preparing our wallet for some of those costs associated with elder care? And I think you brought up a few of them already.
Mm-hmm. Yeah, I brought up a few of them already, and you know, making a plan financially. As I look at this picture on the wall, you know, to be powerful and to empower ourselves and to be ambitious with finances is really a challenging thing. You know, because there are facts out there that there are many people that are suffering out there, you know, and I don't have it like that,
Right.
but I'm thankful to God for what I have because I know where I came from,
Yep.
and I remember where I came from. So just make sure that you have your living arrangements in place. Make sure that you decide as you age where you want to live. Make sure that your social and emotional well-being is in place. Make sure that if you have to have a financial person involved with your spouse or with your loved ones, that person has a dedicated point to those individuals so that they can work out a plan or determine and decide what needs to happen. Because God forbid, I don't want to sell my house to go to the nursing home. I want to be able to, leave my house for my loved ones and to go to the nursing home and get viable care.
Yeah. Good plan. Good plan.
Yeah.
And
So go ahead, Ace.
Oh, no, I was gonna say yeah, and I guess a lot of us don't look far ahead enough to know that, and that eventually becomes a burden for
Yes.
the family. So yeah, just come up with some kind of structural plan and where you, and look at where you want to be at the end of at the end of your years, at your elderly years.
Yeah, and I mean, you just don't know in life what's going to happen.
No.
I have been a educated, self-sufficient, executive type leadership man throughout my entire life. Never would I have imagined that my mental would be taken away from me.
Right.
I had no concept of that.
Yeah.
I thought maybe I would, get to an accident and die, or maybe I would get a stroke or a heart attack or something, but not the mental.
Yeah.
Yes. So.
The funny thing is that we know this as individuals, that we all think it's not going to happen to me.
Oh, absolutely.
And insurance is made for things that might happen. And a lot of us look at insurance like, man, I ain't worried about that. It might happen, it might not. But insurance is a cost until something happens to you.
That's
Then
right.
It becomes a freaking benefit.
Oh yeah, exactly. and we ignore the signs. You got to have insurance, a home choice program to come and fix your home appliances.
Yeah.
Yep.
You got to have insurance in case your house burned. You got to have AAA in case we have a tire. I mean, a car with a tire.
Yeah.
So we have many signs throughout our life to let us know that one day it's going to knock on our door, because what they say, none of us are exempt from anything in life.
Exactly.
And let me add this point. I was going to add it earlier. Don't depend on your kids. They're going to take care of you. I mean, look at your kids right now. Just think about it and look at your kids right now. Imagine them 20 years from now and you having to depend on them completely. It'd be like Trump in 2025, man. We in trouble, man. Like, just you be in trouble with that, man. Just
Well, the shit part about it is that you don't have your kids, but you got Project 2025.
yeah.
Yeah. You can count on that.
Yeah. So,
But when it comes to
the kids plan out the window.
Yep.
Yeah, and when it comes to like creating that financial plan, I do want to make sure that our viewers out there know too, there are government programs out there that you can look at and explore what's available out there. At least before 2025, we've got some programs right now. All right. So also, if you can afford to, get yourself a financial planner, because they will put all types of shit. They know about all types of available options out there. Now, if you can't afford one, there's still resources out there online that you can look up and Google for free, get some information on it. And a lot of us got family members who dabble in these spaces. If you got a second, third cousin that knows a financial planner or some shit, try to reach out to them and get whatever advice you can get for free if you can't afford it. But do something about it as early as you can. It reminds me of the earlier you do something, the better off you'll be. It reminds me of the story about, I don't remember, this kid that started working when he was 16. And he put away some minimal amount of money every week.
Oh, yeah.
And he ended up a millionaire by the time he was 30.
That's
okay?
right.
By
Yes.
putting a small amount of money away every week or every time he got paid or some shit, dude ended up a millionaire.
Was that at
Like,
McDonald's? Was it McDonald's?
I can't
think
remember.
It was,
It's called
might have been.
compound interest.
Yes.
Yeah, but I'm like, dude,
That's right.
there are simple things that you can do. Like, but the earlier you start, the better. And I don't even care if you 50, if you 40, if you 45. The earlier you start, the better off position you'll be in when you start putting that money away. So
That's right. Yes.
now, another thing that you could, actually have, another thing that you can do that'll have a good impact on the world is clicking the like button. All right, so click that damn button. All right, and if you like this content, you want to share more of it out there, make sure that you click on the like button and also subscribe to Left-Wing Kingz and share our content on all of your social media platforms. All right, so tip number 3 was made famous by Kumo D. And Adrian, what did he say?
Go see the doctor.
That's right, damn it. So historically, the black community has had issues with going to the doctor. We've not been proactive in managing our health or engaging in healthy activities. So, Claude, how can regular checkups with your primary care physician help you stay on top of your health and make informed decisions about the elder care?
So, we kind of discussed this about 10 minutes ago, and we talked about early detection of health issues. That's one of the things that we tend to, especially from our culture, shy away from. You have men that have chest pains, and they're like, hey, I'm going to burp this thing up and
take some Tums.
And take some Tums, and I'm not going to worry about it. And then, your wife goes to sleep and come back down the following morning and find you dead on a couch. Mm-hmm. Early detection of health issues is very, 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 very important. Identify what those issues are again with your PCP. We've had this discussion. Monitoring existing health issues. If you're on medication, for example, if you're on a diet management medication and you're having chest pains and the chest pains will not leave, damn right that you're on a weight loss medication. Go to the damn urgent care. Mm-hmm. Go to the emergency room. Mm-hmm. Just knowing what those things are, having the appropriate screenings. Us men, we dare colonoscopies.
I knew you was gonna say it.
Mammograms. People don't go.
Hey, man, my doctor won't answer the phone. I keep calling.
Use a lot.
Yeah, you keep calling. Yes, light your pants on fire.
I call.
Light your pants on fire. Yeah, absolutely, absolutely.
Absolutely.
And I just basically call it the black coat, because you have so many men that don't go and get colonoscopies, and it is imperative if you want to live with your family and do the right thing for your family. Mm-hmm. Go and get those things done. Yeah. You don't know how many people that I talk to, especially males, that look at me and say, "Oh man, look, I'm going to shoot basketball. I don't give a hell about no damn colonoscopy." All right. I had a scare about 5 years ago where I had a precancerous polyp that was 8 millimeters, I think it was, that they took out of me. And the doctor told me, "Well, we'll see you in 7 years." I don't flip and think so.
You gonna see me next year.
You just took an 8 millimeter precancerous polyp out of me.
No.
And you gonna tell me I'm gonna see you 7 years from now?
You're not.
What black fool are you talking to?
Exactly.
It's not gonna happen. And so those are the things that you have to take advantage of and have a building relationship with your PCP. Mm-hmm. My PCP and I have arguments and have problems every time I go. And I have threatened through patient advocacy to get a new PCP. Know who you are holistically as a person. Yeah. And an attorney, Trump, Project 2025, anything does not move you at all. Stand up for who you are and be confident in who you are.
Yeah. Now, I'm lucky. I have a great relationship with my PCP. So if she watching, treat me right. But at the end of the day, me and my PCP, like, you talked about colonoscopy. She said, hey, get one as early as possible. She was like, get one at 40. I was like, all right. I've had 3 since then. I've had one every 5 years.
Yes.
30.
Good for you.
40, 45, and 50.
Good for you.
Had my colonoscopy. Nothing, knock on wood. They found some polyps the first time.
Sure.
None of them were malignant or anything like that. All benign. Everything was good. But the point is, I know
absolutely.
right now my situation.
Yes.
And I don't have to worry about it because guess what? They told me now, they said me, you can come back in 5 more years or whatever. I'm like, all right, cool. But at the end of the day, if something happens, I'll blame their asses because I've been there all the time. So I'll blame all these motherfuckers for doing my shit wrong.
Oh yeah, absolutely. Yeah, absolutely. And one more thing. I had a doctor that gave me dementia medication when they first diagnosed it, and I had uncontrollable poop and urination where I had to wear diapers.
Oh man.
Okay, so imagine in Navy.
Write this doctor's name
so
down.
imagine. That's a damn good one. So imagine being in Navy Federal with white shorts on.
Oh no, hell to the no.
You know, and so
I can't roll like that, player.
You can't roll like that, player. Yeah, I hear you, homie.
But one other thing I did want to touch on before we go on to the next topic was you brought up like not knowing, like things just coming on. I think you brought up, and I've had my brother, like you said, you have a damn, you think it's heartburn or some shit, but next thing you know, you're having a heart attack. That happened to my brother. Like he was like having mini strokes. Had no idea. This was happening for months. He didn't do shit. Just, oh, well, I don't know what that was. I just kind of froze and I just this. Or, he was having strokes. And then finally he had like a bigger stroke where that shit sent him to the hospital. And then he finds out, well, sir, this whole time you done had like 60, I don't know how many strokes, a bunch of strokes, a bunch of mini strokes because he ignored it. He acted like it was nothing, didn't go. I had a friend of mine who had a heart attack, okay? And he told me, like, first of all, he had a heart attack. And instead of calling 911, this is another thing black folks do because they don't want to they don't want to pay the expense.
They don't want that $1,000 ambulance bill.
Exactly. And his insurance or whatever the case may be, I don't know what it is, but he drove himself to the emergency room and collapsed in the parking lot. Ooh. He could have collapsed while he was driving.
Yeah.
And imagine what the story would be today about him or about someone else.
Yes.
Yeah.
You know what I'm saying? Instead of going in the ambulance. So we make a lot of decisions, unfortunately, based on cost versus care. You got to care about yourself first.
Yeah.
Look.
You got to be here to spend the money.
I'll let that shit go to my credit report, nigga, before I die.
Yeah.
Okay? I'm going to go to the hospital first.
Get in line. You're going to get in line with everybody else. You know what I'm saying? I ain't going to die on it, dog.
Yeah, I'm not going to die on this shit.
And by the way, President Biden is working on an initiative that will not allow you to have your medical discrepancies on your credit report.
That's good.
Look into it.
Yeah, I heard
That's good.
Yeah, look into it.
Because we got a lot of those.
Yeah.
Not me personally, but black folks. So, speaking about these tips here, I want to go into our next tip, which is kind of like what we just talked about, like cost involved, but there's a cost that comes with purchasing insurance. And that's tip number 4, to get some insurance. You touched on it already, Claude, so we don't have to go in depth on this one, but, a lot of people out there don't think about insurance until it's too late.
Yeah.
And having insurance in place, can take care of your needs while you're here. And like you said, life insurance while you're gone. There's a lot of good different types of life insurance. But to my point earlier, the earlier you get it, the easier it is to get, right? And before you have healthcare issues, the easier they are to get. So these are things that, we want to make sure that we're looking into now and not waiting until later. But that's tip number 5, really. I'm just going to kind of talk to it. We're not going to go into the question because we're running short on time on this one. But get yourself some long-term care insurance, life insurance. Those things are important. Mm-hmm. And then tip number 5, I'm just going to jump into tip number 5, you guys. So tip number 5 is creating a support network and creating your final preparations. And we also kind of touched on this one. But building a strong support network, that's something that you got to do to be able to discuss your current needs, your future needs, and your final preparations. Mm-hmm. So this could include, like you said, Claude, your family members, friends, your healthcare professionals, all types of people. Sure. Claude, what are some of the things that you should discuss with your support network to make sure that you're ready?
Well, one of the most damaging things within our community is to die and our people that we leave behind hustle and bustle and fight over $5,000, fight over diamonds or jewelry, have access to your house and go in and look at what you have in your house. The only thing that's viable for that is to make sure you have your ducks in a row. If you're not educated, talk to someone in your family that is educated. Talk to friends that are educated. go out to some of the support groups out there and find out what is needed. Look it up on Google. There's a lot of information out there on Google. People like us that are middle class people, we have financial planners and financial consultants that we can go to, and we are privy to have that resource right in front of us. Even with stocks, I'm privy to have what cheap stocks to buy today that will benefit me 10 years from now or benefit me 5 years from now.
Right.
It's sad to say that not everybody is there.
Yeah.
And so, reach out to people. If you don't know how to write a will, go on Google. There are will templates out there. One of the most damaging things that you could do to your family and to your loved ones is to not have a will and go into probate.
Yes.
A year or 2 years after that. I have seen so many siblings that mom and pop thought that they were a confined family. And the mom died and the dad died.
People come out the woodwork.
And the siblings are fighting like rats looking for cheese. What a damnation to our society. What a damnation to our culture.
Yeah.
What a damnation to your family. I was talking to a friend just yesterday, and I'm like, you know what? Your mom and dad are turning in their grave with the bullshit that you all have as sisters and brothers. And I told my best friend, I said, you know what? I don't want to get into your family business, but get every damn body on a conference call. Let me talk to them.
Sound like you got in their family business.
I know.
You didn't want to, though. But
That was a damn disclaimer.
Sound like
And you caught it.
Yeah.
But it's just one of those things. Get your shit in order before you die so that your family can live and your friends can live based on memories and not damnation.
Yep.
Yeah. We all got them stories, man, of people when somebody died, it's just people coming out to fight over them crumbs. You know what I'm saying? We all got them stories. Yeah. So sad. So yeah, take care of your business, man. Write a will, and like I said, don't depend on what man wants something gone. Or even worse, man, I'm gone, man. It's whatever. I ain't here no more. That's even worse to say. You know what I'm saying? Don't put your family out there like that.
And I found out for me, and one more thing, I found out for me that a friend of mine told me that when her mom passed, her mom wrote letters to all the siblings, all the grandchildren, all of the family members. And that's something that I'm doing. I'm writing letters to all of my family members. And I'm going to assign one person to make sure that they get those letters, whether it's good or whether it's bad. Because I think people need to know how you died.
Yeah. It's also important to, like you said, have something in writing, man. When you talk about like a will, that's critical. Like that's the best thing that you can have, man, because people talk. Well, grandma said I could have this and that.
Yeah.
Nah.
The car was mine.
Nah. Yeah, the car is mine. Nah, y'all can argue. You can even maybe grandma did tell that person that, but it don't matter.
It's
right?
just it's like
not
in
legally
health.
binding.
I got the keys, though. I got the keys.
Yeah.
It doesn't matter. It doesn't matter. I
None
can
of
get
that
the car.
Yeah.
The
Yeah.
police can get the car. It doesn't matter. It's just like if you don't document you had the flu vaccination, it's
Yep.
null and void.
Exactly.
You didn't have it.
You didn't have that COVID. You didn't get that COVID
Yeah, I
vaccine.
get it.
It's null and void. So when you go into that club and they're asking you for your COVID ID and you're missing that last shot, get the hell out of here.
Yep. Exactly.
People still
Exactly.
walking around 2024 worrying about COVID. Like, go get the shot,
Yep.
bro. I be telling people, you still worried about COVID? That's an old disease. They got new diseases out.
It's
They got a
the
new one in them.
They
out
got
there.
the bird virus now.
Yeah.
Okay.
Yeah.
But
You still on
people,
COVID?
It's the bird virus now. But see, people are still leading on to that conspiracy.
Yeah.
And the conspiracy, I'm going to say it, is for the non-privileged, poor individuals that are not educated and know that we're not giving syphilis in this day and time.
Yeah.
Yeah.
Bottom line.
They put them. That's who dies from this disease. They put them at risk. You know what I'm saying? So,
Exactly.
like, go get your COVID shot, man.
Exactly.
We had that conversation no more. Man. It's been out 4 years. Ain't nobody dying from the shot. You know what I'm saying? Come on, man.
Absolutely.
Hey, we ain't dying from no shots, but we might die from our
Uh-oh.
the Republican VP pick, JD Vance. He's
Oh.
coming to kill us all.
Here we go.
Look, look, I know I'm going overboard with this shit, but anyway.
Oh, no, you're not. That JD Vance got a lot of things in the closet.
Oh, yeah, he got plenty. So, on July 15th, 2024, during the Republican National Convention, former President Donald J. Trump, who we all know and love, announced that JD Vance would be his running mate for the 2024 general election. Now, unfortunately, JD Vance has flip-flopped more times than a pancake. So it's hard to know what the hell this guy stands for. So we're going to help you guys by breaking down the top 5 things that you guys need to know about JD Vance. So
This
number
dude.
1, what you need to know, one of the first reason that JD Vance, that we should fear JD Vance is his lack of experience. So JD Vance was elected to the U.S. Senate in 2022. Okay? He was sworn in January 3rd of 2023. He ain't been doing a job for 2 years yet. Okay? So, Ace, if Trump is elected, how will Vance's lack of experience impact Trump's administration?
Oh man, it's just hard for me to trust a guy that is younger than the Simpsons. Or, grew up on SpongeBob SquarePants and shit for real. Watched Ed, and Eddie. You know what I'm saying? Just yeah. I mean, he's the VP, so we'll put it in perspective. Like, Trump's not gonna listen to the VP anyway, so it ain't like he's just gonna making like hardcore policy decisions. It's just once again a play from the Republicans. Hey, we're talking about old, let's go get young. You know what I'm saying? That's part of what I think this thing is with him. Well, like you said, he flip flops. We don't know where he is. 1 minute he didn't like Trump, and he was what's called a never Trumper or whatever.
Mm-hmm.
They made up a word for the dude. Now all of a sudden, he's a VP. So that's we're probably gonna get in that a little bit later.
Mm-hmm.
But yeah, his lack of experience. Let's break it down. He has no foreign policy experience. He has no policy building experience. I don't think he's written any bills or anything that we can back him up, or he's maybe been part of them. I don't know. I have to do my research on that. So I just don't think he's going to be. I think it's for show. His pick. He's not going to bring anything to the policy. But once again, 2025, we're going to give everything to Trump anyway. So.
Mm-hmm.
So where's he gonna fit into that? I don't know. So I don't. His experience isn't gonna play a part in it at all.
Yeah. So, just to let you know, he has been part of some bills out there. So, he's on some committees as well. So, I just don't think that his experience is going to help us. It's kind of like we think back about Trump. And as I watched like the Republican National Convention, I hear people talk about how he's the greatest president that we've ever had and yada, yada, yada. And I'm like, he ain't done shit that impacted me personally. Not a damn thing. So
Yeah.
how is he so fucking great? And guess what? He had no political experience. And that's where JD Vance is.
Yeah.
No. What's that?
Your camera. You're on him.
Oh, it's okay.
Sorry.
Yeah.
Matt let me know I'm fucking up.
Sorry.
So, no political experience whatsoever. So I appreciate you, Matt, man. No political experience whatsoever. And at the end of the day, that's dangerous as far as I'm concerned. Their opponents have more, probably 20 times as much experience as JD Vance, and probably 3 times as much as him and Trump put together, or maybe more.
Well, even guys in his party, have more than that. But and what I meant by that, that's why I said I wasn't sure. I was pretty sure he co-authored some bills and did some things like that. I mean, he's in the Congress. I just don't know anything significant that he's done.
No.
That's basically what I'm kind of
Exactly.
getting at with it. And you're absolutely right, man. Trump had no experience, and I've always said you don't want a guy working at the convenience store that ain't got no experience. Why would you want him being a president and a vice president? But once again, I think the Republican Party's all for show. They're just all trying to get votes, and they're just trying to get the position and get into power. They don't really care that they have people that know what they're doing, to actually care about passing policy that's going to do anything good for people. And JD Vance is just the newest example of what that is. You know what I'm saying? Just a showpiece that's going to be out there that's going to look the part, but ain't going to do anything.
Yeah, that's like my wife, who don't like going to the dentist at all. Going to a dentist that ain't never touched a tooth. You his first tooth. You the first tooth this nigga done touched. Do you want that shit?
Going to UTSA, the dentistry school, and getting your
Wrong place to go.
you don't want that life, bro. You know, hey,
You know what I'm saying?
dentistry school ain't the place you want somebody trying out on. You know,
But you the student's first tooth, nigga.
First tooth, yeah.
No, thank you, bro.
Same thing for cosmetology. You know, you go to the cosmetology school to get your hair done. Well, guess what?
Yeah, this your first head. Right
That's
here.
right.
Your first head, nigga. That's what he. Nah.
that's why it's
nigga.
$5.
So, but you know, one of the critical pieces about this is that think about how non-essential he is for examining the impact on education, health, the environment, criminal justice, and also faith. Think about the impact that JD, what his name is again? Vance. And also, guys, he's had numerous names throughout his life as well. You know, I just think that it's critical.
Yeah. I mean, another thing that's critical is your taxes. So I hate paying fucking taxes every year. But guess what? That's another reason that we should fear this guy, is because he's all about corporate tax cuts.
Yeah.
So while Vance says that he would have voted for the Trump tax cuts if he was in Congress at that time, he has a memoir out there called Hillbilly Elegy, which chronicles his upbringing in Ohio and Kentucky. And basically it makes him seem like he's this working class dude. And he was a Marine too, so he connects to the military. But those things are kind of like, you know, conflicting with one another. You supporting tax cuts, but you a working man. Okay, wouldn't you want the working people's taxes to be cut? But that's neither here nor there. Ace, is Vance a man of the people, or is he a man of big business?
He's a Republican, you know, and the Republican Party's confused. You got these guys, and I always tell them, Trump's not your guy. Republicans aren't your guy. They go for corporate taxes. They go for the CEOs and making sure those guys are good, and the 1%. Vance falls right into place of that. He tries to talk like he's a working guy. End of the day, in the story, his voting record, which is going to be influenced by Trump, which is going to be influenced by Mitch McConnell and all those higher-end Republicans, votes for corporate taxes and stuff like that. Called trickle-down economics. Look at that. They tried to do this in the Reagan era. That's how long they've been trying to do this. It hasn't worked. You know what I'm saying? Hasn't. Every major economic problem you have, let's take it back to the Bushes in 2006 and 7 when they crashed the economy, came from trickle-down economics. Doesn't work. We're going to give the corporate people tax cuts, the higher-end people tax cuts. And what do they take with that money? They put it up somewhere. They don't even share with the economy anywhere. So they put that money up. It's called the rich getting richer. You know what I'm saying? And what happens to us down here, we're the ones that have to foot the bill and pay everything. So it's just that basic thing. So to answer your question directly, no, he's not for the working class. I don't think that it's coming from his upbringing. It's coming from the fact that he's in the party that's not going to allow him to do that. He's talking the talk, but he's not walking the walk.
Well, you know, and not to challenge any of my white counterparts that are out there in the audience listening, that I have great relationships with. You know, I have always have a firm belief that racism is inherently amongst white communities. So you could be one of my friends on this platform and in the audience, and you can tell me that you're not racial, and you may not be, but you were raised in an inherently racial environment. You've seen your mother and your father and your grandmother and your grandfather talk bad about black folk, but thank God you're at the right place.
Right.
Just thank God that you're at the right place. To my white counterparts that are listening, that I dearly love.
Yeah, no, you're absolutely right. Systematic racism is real, but yeah, and he's kind of in a systematic Republican Party. That's what they do. You know what I'm saying? Hey, look, it ain't the reason Elon Musk and Warren Buffett and all the high end, Bezos, these guys are behind Trump. You know what I'm saying? And they're not being political at all. They got enough money to not be affected, but they know for the simple fact that he's going to do things that make their corporations money. And cut taxes and put more money in their pocket, which once again they're not going to put back into the economic system and make us prosperous. They're going to put that money up and keep it. That's what they do with profits.
Yeah. Think about this. Elon Musk just announced a few days ago that he's going to donate $45 million a month to Trump's campaign.
Yeah,
$45 million a month, not a year, not every 4 years, a month. Mm-hmm. What's the return on the investment from that? To your point,
deregulation.
What's the tax cuts, deregulation, all type of shit? He ain't giving this fool $45 million a month for nothing in return.
No, he's just helping him, helping him have thoughts about taking the military and putting him in the streets for crime. Mm-hmm. He's just paying the $45 million to get the ships and put them on our main streets for all us black folks to get on. Mm-hmm. It is evident, again, guys, with Project 2025. I had a great conversation with a white counterpart yesterday, and he tried to influence me to insist on understanding that Trump's not involved with Project 2025 and that... look at the Agenda 47. Man, get the hell away from me.
Side by side comparison.
Get the hell away from me. Side by side, those are both criminals.
Yep.
And they have 54 convicted.
Mm-hmm. Exactly.
Okay.
Yeah. Oh, yeah. I'm going to start telling some of my white counterparts. I like that word that you're using. Hey, Trump ain't involved with 2025 just like OJ wasn't involved with killing Nicole Simpson.
He wasn't. I don't care what nobody say. He was found not guilty.
No, yeah.
I hate when y'all say that shit.
No,
guilty.
Yeah, but that's what I'm saying, though. I hear what
you agree. Okay,
No,
good.
but I hear what you're saying. But hear what I'm saying.
If you don't feel force it.
You tell some of my white counterparts that.
Exactly.
That's
okay,
what I'm saying.
They'll connect to them.
Yeah. Oh, no, yeah. That's the way we look at Trump in 2025. Like, dude, everybody that worked on that shit used to work for him.
Yeah.
The Heritage Foundation been endorsing him.
Yeah.
But he don't know nothing about it. Well, here's my question. If he don't know nothing about it, well, shit. He got a memory like Biden then. He
exactly. He don't know who David Duke is. He don't know who the Proud
Since
Boys are.
Since we on the dementia show, he might have dementia. If he don't know nothing about 2025.
Well, one thing they'll find out who the Black Panthers are.
Oh, they gonna find out.
And the guy that was on at the convention, the Hulk guy that was pulling his shirt and all the rest of this stuff. Yes, it's like, okay, you're telling us that you're going to the Capitol again.
Basically,
that's what you're telling us. And if you're not telling me that, then you're telling me that you're going into our black communities.
Yep.
Because your disposition and your demeanor on that stage had everything to plant racism.
Yeah. Yeah.
We know the story behind Hulk Hogan. You know what I'm saying?
Yeah. Well, I know he wanted to plant racism, but I want you to plant your finger on that like button. Okay? So, make sure if you like this content to click on the like button and also subscribe to Left-Wing Kingz to see more of our content and share it on all of your social media platforms. Now, let's see. The reason that we should fear JD Vance, the third reason we should fear him, is a love and hate relationship with Donald Trump. So initially, Vance was a never-Trumper, a never-Trump conservative who referred to Trump as noxious and America's Hitler. He has since aligned himself with the populist nationalist wing of the GOP. Ace, how should we view this extreme political shift?
It should be a warning sign on where this guy stands. It makes me think that he's just honestly in it for, he's in it for himself. He stood strong on not being a never Trumper. America's Hitler, that was strong stuff
That's
to
some
say.
strong shit. Yeah.
You know what I'm saying? And even though, hey, you know what? Once again, I tell people all the time, go look at Hitler in the 30s, see how he took over Germany. It's the same playbook that Trump's using.
Yeah.
But I ain't calling him America's Hitler. I've reverted very closely to it. You know what I'm saying?
Yeah.
But this dude went out and said the words, and so I believe there was a time that he believed that, but I also believe there was a time somebody got in his ear and said, "You could be the next vice president," and so then he flipped completely to do that. Why? He did that because being in that position, the prestige from it. Mm-hmm. Because if you become a vice president, then more likely next time they're gonna already assume you're gonna be running for the presidency.
Mm-hmm. Yep.
So he's doing whatever it takes to get over there. So that already makes me not trust him. So I already know when he's in there for himself. He's not in there for the people.
Especially at 39 years old. He has the ability to be the next president.
Yeah.
But it's one of those things where it's like, hey, it's null and void. I mean, you put this guy in and it's over.
Yeah.
Oh yeah. We ain't gotta worry about that.
The funny thing is, him and Trump are like mirror images of one another in many ways, because Trump will say something and then he finds out that it's not good, so he'll just change his stance all of a sudden. Yeah. Like he talked about abortion. When it first came out, he was all behind like, hey, no exceptions and the 15-week rule and all this other shit. As soon as he started seeing what America and the women were saying, he backed away from that. Well, there has to be some type of exceptions for rape and molestation and da-da-da. Where was you? You didn't say that at first, but you change it. You're changing to fit the narrative of the voters so that you can win. And JD Vance, to me, he does kind of like the same thing. He's like, oh, well, at first, you know what? He's a bad guy. He's horrible. Then the rest of the party likes him. He's like, oh, now I like him too. Mm-hmm. So they're kind of like mirror images of one. I think that's what attracted Trump to him, is that this fool will just change some shit. He'll change his stance in a heartbeat if I tell him to.
Yeah. Shoot. Trump was a diehard blue Democrat. You know what I'm saying? Went on air and said, if I ever run for president, I'm going to run Republican because they're the dumbest people out there. He went on the Phil Donahue show and did that in the 80s.
And then he did what he said he was going to do.
He did what he said he's going to do. So, yeah, so we all know Trump said, he says what the people want to hear. But we all know he has a hidden agenda on what he's trying to do. So,
yep,
that's nothing new.
Well, something else that's not new is how these fools be treating women. And that's fear number 4. And that's suppressing women's rights. So in 2022, Vance declared himself 100% pro-life. And when asked about exceptions for rape and incest, he was like, hell no. Okay? So this is what he told the Washington Post in 2021. So what he said was, 2 wrongs don't make a right.
2 wrongs don't make a right.
Okay? Since then, he has shifted his public stance. This motherfucking has shifted on his issue, and amid speculation that he was going to become Trump's VP pick. So, of course, he shifted his stance to match what Trump was saying. So, Ace, how can we believe anything that comes out this dude's mouth?
Man. We can't. Especially if you're a woman, you can't. You know what I'm saying? He's not looking out for you guys at all. You know what I'm saying? I mean, but that's a lot about the Republican Party. And when you talk about the white Christian nationals and the anti-abortion. Well, they're not the anti-abortion, but the abortion movement, the anti-abortion movement. Those people, these politicians on the Republican side are gonna go where they think the polls or the voting is gonna go. We know damn well Donald Trump don't care nothing about no abortion.
No.
He probably got about 50 abortions his damn self. You know what I'm saying?
Probably.
So he's not on the strong stance, but he's going to go out there and say the things that he needs to do to win the base.
Yep.
So then he's going to turn around and he's going to segue in the middle. Hey, you know what? I'm going to just push it to the states. So he's going to try to stay in the middle. So it's not actually saying that he's supporting it, but we know for a fact when he gets in front of white Christian nationals, he's going to talk about the 18-week ban or whatever the case may be. If he's down there with DeSantis, he's going to talk about that. So putting that into perspective, JD Vance is the same way, man. He's just going to follow wherever the party's going to take him, pretty much.
I just think that from a perspective of women's rights overall, that we're at a sad place, man. And I'm not going to blame this on parties. I'm just going to blame this on America's view of how we treat women overall. We've talked several times, and this is kind of shifting topics, but we've talked several times about how when a woman brings up the fact that, like Anita Hill, that she was raped or treated wrong, we look, oh, she's lying. She's trying to get money. What's her name with P. Diddy?
Yeah.
The one that got beat up at the elevator.
Cassie or whatever.
Cassie.
We just did that with her, I was going to say.
That she got beat up and she was just claiming, everybody jumped on Diddy's side and said, we don't believe her. We always...
Till that video came out.
Right. We always go against women, whether it's for women's rights, whether it's... They weren't even allowed to vote. Mm-hmm. Okay? They were not allowed to vote at some point. So when I say that this is an American problem, it is an American problem. It still exists. And we need to really understand that, because when we talk about racism and America being inherently racist and being founded on racism and being founded on our backs as slaves, that is true. And so is the progression or lack thereof of women's rights. Okay? So they're still trying to hold on to their ways to make sure that women are on an unequal playing field and they're not getting the things that they deserve, and their rights are violated just like our rights are violated every day by things like Project 2025. This is just another way that they see to violate a woman's rights to do what she wants to do with her body.
I don't get, like, if somebody's rape or incest, why that just ain't a no-brainer? You know what I'm saying?
You gonna have that rape, baby.
Like incest?
It's
You gonna have that.
Well, I also goes to the census report.
This is Game of Thrones. Nigga, they having incest babies running around this bitch.
And I just
goddamn dragon.
I think it's falling into population things because some people don't want to be a minority. They want to stay in the majority. So any baby counts. You know what I'm saying?
And
incest babies? Come on, man.
Yeah, and it's just an emotional thing thereafter. So, for the rest of that child's life, and for the rest of the mother's life.
I gotta look at this rape baby.
To go and get ice
Damn
cream,
rape
to go and get ice cream with your child, and to know that your child is here because your next door neighbor raped you.
Or,
Exactly.
I got to call this fool Uncle Daddy. You know what I'm saying?
Yes.
You goddamn dunkle.
That's my Uncle Daddy right
That's
there.
my dunkle.
Yes.
No dunkle.
Absolutely.
Like, come on, man.
And we had a situation in my family where my aunt's oldest husband raped the youngest daughter. Okay? And we have a tendency of saying, hey, you know what? You're 14 years old and you were the problem because you went walking around this house in your shorts.
No, see? Yeah. Once again, blaming the woman.
You're the problem. You're blaming a woman. You're not blaming, what was he, 38? You're not blaming that 38-year-old man that did the rape.
Yeah.
Okay? But then this child is taken away from, so much shit.
Yeah.
And it goes back to what you say. When are we going to give justice to the females? And hats off to the females. Hats off to the black females. Because I tell you, even with income now, hats off to our beautiful black women.
Yeah. It's everything. Glass ceiling, pay inequities. Like, we just hold them back from everything. Just trying our best to keep them down. Why?
That's right. And also too, and also too, let me clarify that. Hats off to our female women, period. Our females, because even in the white society, men like Trump think that they have control.
Yep. Exactly.
Yeah, I think that's why you hit on the head. Why? That's that control factor with them. You know what
Good point. Yeah.
You know what I'm saying? It's a control thing. But like I said, there's some no-brainers like rape and incest. Why are we even having that discussion? Like,
I don't know.
Come on, man. And and we got the technology. And I want to tell you about the horror stories when women getting abortions back in the 50s and 60s and using coat hangers and dying in back alleys and stuff like that, and getting these crazy ass dudes, doctors or whatever, in the back, or not even doctors, to perform these. So we're going back to that. But once again, why?
Yeah.
And then people won't make it biblical. I don't think God would give us the technology if he just, come on, it's all his
Right.
anyway. He wouldn't do that.
Well, that's what they're saying about Project 2025.
Yeah.
That there's some spiritual, that there's some biblical reasons behind it. Bullshit.
Yeah. That's like they said that about slavery, didn't they?
Yes.
They sure did.
I'm saying so.
Yes.
Yeah, the Heritage Foundation. Come on, that's the same dude that said if the left lets us do it, then there'll be no bloodshed. That's that guy.
Oof.
You know what I'm saying? So this is what we're running into, and people just ignoring it, man. So hey, you don't ignore it. You're gonna look up 2 years later, wondering how the hell I got the police knocking at my door, asking me questions I don't want to answer.
Yeah.
You know what I'm saying? So
Yeah. Well, we can't ignore that, man. And another thing we can't ignore is fear number 5, which is support for global democracy. So JD Vance feels that the United States should stop funding the Ukraine. He feels that European nations should do more to support NATO. And he feels that we should be preparing for a conflict with Asia. So, Ace, what are your thoughts on JD political global views?
when I read this, I was like, wow, this kid is just far away from, and the reason I say that, he's far away from World War II and really knowing that. And the reason I say that was because I think that anybody, and most of the World War II veterans and people around kind of died off, and know and understand the impact of Ukraine and understand the impact of what Russia's doing, and because we refer back to what happened in World War II. You know what I'm saying? So, like, it's just, it's almost like they forgot, you know what I'm saying? And I just think it's a generational thing a lot of times with them, never been around a situation where we were actually in war with people.
Right.
You know what I'm saying? Most of the people we have now, it was Vietnam. And we had that fight, and we saw it. I mean, yeah, and we've had, like, Desert Storm and stuff like that, but a real war that we were, like, actually vested in as a country was, like, Vietnam. Before that, that was, like, World War II. And World War II, we understood the political impact and what we needed to do as a nation. So when they start talking about NATO and stuff, they don't understand the importance of it. They don't understand how important NATO was to keep this world the way it was, because Hitler actually tried to take care of the world and killed way more many people than they've ever seen in an actual war. You know what I'm saying? And I think that part of what JD Vance's knowledge comes from is that, him just not knowing and understanding the impact of it. He says a war with Asia. Well, let's be real. Even though we have issues with China and stuff and North Korea, they haven't invaded anybody.
Nope.
Putin has invaded people, and we know for a fact is planning on invading more people. That's the problem at stake right now.
Yeah.
And if you believe taking money from Ukraine and let him take it over is going to win, you don't know your history, bro.
Right.
You know what I'm saying? You just talked about Trump being an American Hitler. What do you think Putin is right now? You know what I'm saying? That Trump's warming up to. And I think a lot of that, because a lot of our people that really experienced World War II are dying off, and people don't have that interest in that history no more. That they forget, man, how bad things can really get real quick.
One thing I want to kind of touch on from what you said, because I agree, but I do want to add some perspective to it as well. So you're right. NATO was formed like out of World War II and what happened with Hitler, and helping Reconstruction, and like trying to prevent shit like that from happening again. Like we're going to band together and shit like that. But, and I know JD Vance doesn't have a understanding of that, because that happened a long time ago, but he does understand. He as a Marine, he did go to Afghanistan. So he understands our political impacts that war could have, at least from a perspective of a Marine and being a soldier on the ground. So he does have that on his side. Now, that might even change his perspective to feeling like he felt like maybe the United States was over there trying to fight this, in Afghanistan. He felt like maybe we were on our own for the most part. Even though there were other countries there, they didn't have as much of a presence as the United States. So that might make him feel like they need to be in this game more, because we fighting and using all our resources for shit. So I understand a little bit what he's saying, but I also understand what you're saying. He doesn't have that greater context to it. The other thing was the Asia thing. One thing I do think is that Asia is really building up their arsenal right now. Like, I think like China has like the biggest navy in the world now, or North Korea is building up their nuclear weapons and all of that shit. They bold as fuck, just going out there in the damn sea close to shit that they shouldn't be close to, and you know what I'm saying? So I do think we need to have an eye on these motherfuckers, and if they have surpassed us in munitions and ships, it might be pretty important for us to start building some motherfucking more ships and stuff. If that's what he's saying, I don't really know extensively what his plan might be, but preparing for Asia could be things like getting our weapons right, getting our ships right, getting our equipment right. Like, that shit, I would be like, yeah, you know, these motherfuckers attack us right now. If it's a water fight, we losing. You know what I'm saying? So,
I think you got to look at all of them. You got to look at Ukraine. You got to look at Iran. You got to look at Asia, North Korea, China, all of that.
yeah.
Because as we're sitting here talking, and Turkey's in, you know, kind of sort of in that a little bit. As we're sitting around here talking about NATO, these guys are meeting, and they're
have
forming
powwows.
they're forming an
absolutely.
alliance. So
Coalition.
I think that a lot of times we try to divide up, you know, the food on our plate, but end of the day in the story, we might end up fighting all of them.
Yeah. Well, my point is this. I agree with you. But we got to get out of this being this reactive place. We react to every fucking thing.
Yeah.
And if JD Vance is saying, let's be proactive and get our shit ready, let's do that. Because if we were proactive about Russia, maybe the motherfuckers wouldn't have went and took their ass and jumped into Ukraine. But guess what? We were reactive. So now we afraid to even go over there. We want to give money to support it, which I think we should be giving them money, but I also think there's other efforts we should be giving money to as well. Like, you know, we talked about Nigeria, and we talked about other areas out there.
Sudan, you know,
Sudan, like places that deserve money too. But at the end of the day, if we were proactive with this shit, we could have prevented it. And that's what being proactive usually helps you do. Like, I brush my motherfucking teeth, I floss, I do all this shit because I don't want my fucking teeth to fall out. That is proactive action. I'm not going to wait till my teeth fall out and then say, well, denture time. I'm going to try to fight that shit off as long as I can.
That's right.
You know what I'm saying? By being proactive. And we're not being, it's simple things that we don't do that kind of make me look and say, hey, JD Vance might be right about this. Now, I'm not a JD Vance fan, but I would like to adopt that from a democratic standpoint. How can we adopt that and be more proactive with shit rather than saying, hey, we got to give all this money to Ukraine? Think about our flaws, fix them, be proactive, and then we don't have to give money to Ukraine. If we would have did the right shit first.
Yeah, and you know, first, you know, we have to sit down and work together.
Yeah.
That's the first part.
True.
And that's the major part of the dynamics. We should have been prepared for COVID.
Yeah.
We knew years ago about a drastic epidemic that was coming into this country.
Obama wrote a playbook on it, didn't he?
Obama wrote playbook, white paper on it. It was ignored. When Trump got in office, he took the resources away to further research. Then he recommended folks to drink bleach once we got it.
Yeah.
That shit was crazy.
Well, I like how we don't talk about that, though. You know, when it comes to him. Like, he took, Obama had a playbook for COVID already set up, and he ignored it, threw it out everything else. But then when COVID hit, oh, man, that ain't my fault. Like, get out of here.
And the resources, yes.
Yeah. But back to kind of what you're saying. It's funny because I've been looking recently at this documentary on Netflix called Turning Point. And it talks about how we kind of made a mistake when we said in the 80s we ended the Cold War. And the Cold War has still been going on. That's how we got to Ukraine.
Yep.
And a lot of people right now, they'll blame, hey, man, we know, and they'll say this, well, you know, man, there was no wars when Trump was around. Biden just, you know, he walked into Ukraine with Biden. But you got to understand, he actually attacked Ukraine in 2014 under Obama.
Yep.
But he was already having issues with George Bush when he was going into that.
Yep.
You know what I'm saying? So the whole time, this whole time since Reagan, they opened the Berlin Wall and supposedly ended the Cold War. It's just still been going on. It's just been more covert right now. It's a whole documentary on it, man. So it's exciting. So it's crazy, man. So once again, we gotta work together and do that. But you're also right. We can't ignore dispense funding and just be out. This world's too crazy right now. Like as you say, Asia's getting stronger. Russia's definitely getting stronger. You know, Iran is backing Hamas and all that happening in Israel. Dude, I always been saying this. This ain't happening on no accident.
Nope.
It's the turmoil that's happening in the United States, and it ain't because Biden became president. You know what I'm saying?
Yeah, and right now, as it exists today, right now, this week, China is spending billions of dollars on artificial intelligence, on AI. Over the past month, we have seen a drastic change with everything interfacing with AI.
Yeah.
And most of the folks that I talk to that are close to me, I don't believe in it. I don't want to get to it. That is not 90% accurate. Well, guess what?
It's the future.
It's the future. Get with it, because China is spending billions of dollars on a facility and the technology that will outweigh the entire world.
Yeah.
And just since we're on a technical term real quick, you can't tell me nothing, man. That attack that happened over the weekend at Microsoft, that was an attack. They can tell me what they want.
Look, you conspiracy theorist, nigga.
You don't think that was an attack? That was an attack, man.
That was no damn attack, man.
All the airports went down at the same time.
I got up and heard it on the news, and I said the same thing. And they're like, "Oh, it's the first time it happened." Yeah, because we gave whoever
So
that business entity, we gave them everything to shut everything down.
You the technical guy.
I'm the technical guy, and I can tell you this seemed like to me that it was exactly what the fuck they said it was. First and foremost, the CEO of their company went on TV and he said, "This was me. This was our company, and here's what we didn't do. We didn't do our due diligence. We didn't do our pilot, right? Of any time there's a patch that comes out that they need to do, they do a pilot and they do testing to make sure that it's going to work before they send it out. Well, their compliance kind of broke down, and they sent it out there, and it was faulty, and it fucked up some shit. First and foremost, if you're a company, you gonna take the motherfucking fall for a global technology issue. This shit happened to Amazon, airports, security
Everybody.
companies,
We was affected by
911. This shit impacted like a whole shitload of people. And I do know that corporations do like anybody else does. Everybody else starts watching Netflix. Everybody else watches Netflix. So everybody gets Netflix because everybody got it. Well, if there's a software that's working for your security and a big company like Microsoft is using it, or these other companies, then everybody starts to use the same company.
Salesforce.
That's creating Salesforce. That creates a bottleneck. If that fucking vendor falls or fucks up or just shuts down their door, or somebody does attack that vendor, it fucks up everybody else. So to me, that's what happened. I believe it. I believe what they're saying. But now what they're trying to do that I don't like is give them kind of like immunity from being sued. Because everybody should sue the fuck out of this motherfucker for doing what he did that fucked up all of their companies. And if that happens, then I will tell you right now, it was not an attack. It was that motherfucking company. Because they're going to sue his ass. It's a wrap.
That's right. Yeah. I have been in software development. I've been in system testing, been in project management, network development. Why is this the first time that it happened?
That's a good question.
I have been in those four technical environments, have worked for Microsoft in Seattle. Why is it at this time that's been a problem?
That's a good
system testing, quality testing.
That's normal shit.
Network.
That's not something that you should forget.
Debugging.
All of that.
Relationship management. Iterative development.
Yep.
I can go on and on and on and on. Something happened where they were conducting a test to destroy what? The world.
Another conspiracy theory, but I can see that.
But think about it. I was looking at the TV yesterday, and I said, healthcare, you can't go to the doctor. Everybody in there that's on machines die. Banking, I can't go get my damn money because the ATMs are not working.
Movie that just came out with
transportation.
Yeah, transportation.
Yeah,
everything. What's that Netflix movie that just came out? The black family, they went like they let somebody stay in their house as an Airbnb. So a white family came there, and then the black family comes back like, we need to be in our damn house. That's what happened with that movie. There was like this thing that just fucked up the whole world. Technology was just fucked off.
I don't believe in conspiracies, but I have enough skills and knowledge in the system development and quality testing and system testing arena to know that with iterative development, you never, ever should make a global mistake like that.
Well, I would say this. I would argue that point to this. My company that I work for, I work in IT in my company. And when we fuck up something, it's contained. And we've had fuck ups. Okay?
Roll back. Roll back then.
Right, exactly. But what I'm saying is, we know all the things that you just said. We know all the things we need to do. We know the simple, but human error happens. People make mistakes. And the next thing you know, our website's fucked up. Or our app has, this page on the app don't work or whatever. We roll back, we fix it, and we move on. But my point is this. Human error can happen. The problem was this one company supported thousands of companies. That's the problem. There should not be one company with that much power that if they fuck up thousands of companies. If we fuck up in my IT department, we fuck up my company. And that's it. That's all we fuck up.
Well, guess what?
That's the problem. They were all working with a vendor, like you said, like Salesforce or whatever, or Amazon, whatever that vendor is. And the vendor fucked up, and they have so many people relying on them that it ended up being a global issue. But
we didn't have that issue for Y2K.
Yeah.
Y2K was 95% smooth.
Yeah.
Now, currently, as today, when we get to product 2025, we got one man that can push the nuclear button.
Mm-hmm. Yeah. Well, only button I care about the like button. So I don't care about no damn nuclear buttons right now.
I care about the nuclear button.
But let me just say this, man. Hey, this has been a great episode. We want to just go ahead and say thank you for Claude coming out, joining us, rocking with us today.
Thank you.
Your experiences, your knowledge, the things that you bring to the conversation are vital. And I mean, guys out there, man, make sure that you are taking care of yourselves, take care of the people in your family, and take care of your final preparations for yourself. No matter what your health is, man, always take care of yourself, because you don't know, like Claude said, he never imagined that he would have dementia. This is not how he thought he would go. We don't know. And until we start going to the doctor on a regular basis, get yourself a PCP if you don't got one. Please, not just a doctor, just because I got a doctor for this. You need a primary care physician, because that is how you get all of your information. They see shit, and they send you to the specialist. That's where it starts. You know what I mean? Make sure you get that. Make sure you do it. So thank you guys for checking out another episode of Left-Wing Kingz, and we'll check you out next week.
Yeah.
Thanks, guys. That was good.